Okay, welcome to day 6 of our psychology training. We have learned about theories, we have learned about basics subjects of psychology. We are exploring basic topics in psychology. Now we are going to learn about mental health disorder in this chapter. Everyone who is associated with psychology or who want to study psychology is very fascinated by mental health disorders. Okay, why? Because they want to get it is very kind of a puzzle है ना, which is going to get solved. If you understand someone's behavior and if you form some diagnosis or something, then you will be like you have solved a puzzle, you have solved a mystery. So yeah, mental health is like a puzzle, complex but solvable. As a psychologist, a lot of people go for diagnosis of a problem, which is very important. But at the same time, if you have diagnosed something and if you know the solution, and without any particular diagnosis you are solving that problem, you know what kind of problem it could be. Diagnosis is kind of hypothesis you build. Okay, so without diagnosis also there's possibility that you can solve the problem. Okay, so don't focus on diagnosis and only like diagnosis. Why? Because a lot of people still are not very good accepting that they have some kind of mental disorder of stuff or any difficulty with related to mind. Why? Because it still it is a stigma in society, it is a taboo in society to talk about someone's mental health. Yeah, there are areas which are developing, there are people, there are families who are doing good in mental health practices, they are practicing good mental health practices, but yeah, still there is a stigma and there's taboo in society. So we have to consider it. Why? Because now we have already learned social psychology. Yeah, so this is what mental health is. Mental health is like a puzzle. Okay, now let's explain what are, like, there are different kind of disorders. Their syndrome is there, their disease is there, their disorders are there. We are going to study disorders in our ICDs and stuff, but there are still diseases are there are still syndromes are there. Now understand what syndrome, disease and disorders are. Okay, so now while studying all these syndromes, disorder and disease, we'll focus on observing the patterns to understand the mind. Okay, there are pattern in a mind. If there's some symptoms are there na, so with these symptoms there will be a neural pathway which will form a pattern of behavior. Okay, so this is what we are going to study in mental health disorder stuff. First, understanding the key concept, which are syndrome. Syndrome is first. Let's try to get some three cases. Let's study. Okay, so there's a Rohan which have learning difficulty, and there are some trait related to, like, there are few symptoms. Okay, of learning disability. There are some few symptoms of some kind of observable symptoms where there's a trait of personality which is somewhere we can observe as abnormal. So there are some trait associated with, and there's a kind of a specific learning disability is there. Okay, now there a lot another example, another case where there's a Dadaji who is having Alzheimer's disease. Okay, who is having memory loss, who cannot recognize things, who cannot recognize stuff, and he's just like day by day the condition is getting worse. And now there's Priya, another girl who is having anxiety. Okay, who is very anxious while performing day-to-day routine tasks, and now it is affecting his functioning. Okay, now it is affecting his day-to-day life. If there is problem doing any stuff, if he want to go to somewhere, he just can't decide by what way he should go. Like means of transport she can't decide, means of communication she can't decide. Okay, so this is kind of difficulty Priya is having. In first case, where there is collection of symptoms seen in a person, it is called syndrome. Whenever there is collection of symptoms, we call it a syndrome. Okay, so syndrome is what? Syndrome is collection of symptoms which have no further diseases diagnosis or somewhere, but yeah, there are trait or there are symptoms of some difficulties or some disorders or some disease. Okay, which can be from diseases or which can be from disorders, but it is not just a collection of symptoms are there, then it is syndrome. When with that there's it has a known cause, because of something these symptoms are there. Okay, in Rohan's case we don't know what is the reason behind his symptoms, but in Dadaji's case where there is memory loss, it is the degenerative health of his brain. Okay, we have already studied in neuropsychology what Alzheimer's is, how Alzheimer's and Parkinson's happened. Okay, so neurodegenerative disorder. So there is neurodegeneration, which is the reason of these symptoms of memory loss. Now we can say it is a disease. Now, if there is no reason there, okay, everything has a reason, but if there's no particular specific reason, but there are factor affected it, and now it is something which is causing problem in day-to-day life, there is disruption of daily life, now we call it a disorder. So now we have understood what syndrome is, what disease is, and what disorder is. Okay, so whenever we say in psychology we say disorders, so though with known or unknown causes, there are n number of factors which can be associated, n number of etiology which can be associated, but the most important thing is it is disrupting the person's life who is having it. Okay, so this is what we in psychology we deal with mental health disorders. Now we have talked about symptoms. What symptoms are? Symptoms are reaction towards some state or a kind of behavior a person do. Okay, so there are two kind of symptoms. First is primary symptoms, second was is secondary symptoms. Okay, primary symptoms, what if the direct symptoms of a disorder, of a disease, are primary symptom, like mania's elevated mood. If the person is having mania, he is having elevated mood. If he is having his voice is going, the rapid speech is there. Okay, and if there is a person who is having depression, so there will be low mood, there will be loss of social interaction, there will be a lot of so the direct effect. Okay, because of that. Okay, so the direct effect of any disease is primary syndrome, and the reaction to primary ones. Okay, so the maniac mood, the mood where the elevated mood, so the reaction towards that elevated mood, like high pitched sound or doing something like work which is not in his hand, like doing something which is unachievable, this kind of stuff is what they are secondary symptoms. So we have to study secondary symptoms which are observable. Primary symptoms are also observable, but yeah, secondary symptoms are mainly the reaction to primary symptoms. Okay, so if you observe a primary, if you observe a secondary symptoms, so you have to understand of what is the reaction, what is the source of this reaction. Okay, the source of reaction is primary symptoms. By collecting data of primary symptoms, we can move towards proceeding to diagnose some case, or we can move toward understanding the behavior of that person, why the behavior of that person is like that. If there's some possibility symptoms of some disorders are there, in early intervention is there, so in early intervention we can understand, yeah, okay, this is the case which is going to be happen in future. So predictive validity is also there. The prediction is also there in abnormal psychology. Why? Because in psychology itself, because it is empirical and it is use scientific approach, that is why predictability is high in psychology. Now let's understand what is abnormality and why there is stigma in society related to abnormality. There is a painter named Arjun. Okay, he used different kind of patterns, and he make weird pattern with his paint. Okay, not so modern art, not so particular traditional art, but something weird. So now, is it Arjun an abnormal person, or is it Arjun a normal painter? Yeah, the thing is, there is possibility of considering Arjun abnormal and normal both ways. If there's a culture where these kind of paintings are there, where these kind of drawings are there. Okay, so now Arjun is considered as normal person. Why? Because he is following his culture. Okay, but now if we assume, if we assess Arjun statistically, okay, if we study 100 painters on that town, and only Arjun is painting this kind of weird stuff, so now the Arjun is abnormal according to the statistically indifference, because he is different from the society. So similarly, the definition of abnormality comes. This bring a weird and a wide point of view. Okay, first thing, nothing is abnormal or normal. It is just context, behavior and functioning. Okay, So you should understand, you should practice unbiasedness, knowing it. Okay, if you understand that abnormality is what it is, just in some cases, in some context it is abnormal, in some context it is normal. Similarly, if we talk about aggression, so if someone is aggressive, okay, in a soft relationship, in kind of relationship, in a family relationship, family function, as someone's showing a lot of violence, lot of aggression, now we consider that person abnormal. Why? Because in family we don't see much of stuff like this. Okay, in social setting we don't see a person acting in a way. But what if there's a war zone? In war zone everyone is aggressive, the person who is not aggressive is abnormal. Okay, so understanding context is what which we study. Okay, so context is very important. At the same time, what the person is doing, behavior is also important. If there's the setting allows you to be aggressive, then aggressive behavior is okay, it is normal. But if the setting doesn't allow you being aggressive and the behavior is aggressive, then it is abnormal. Another thing is functioning is also there. If the mental processes, the cognitive processes of that person is ruptured, is abnormal, okay, like the cognitive activity he should perform is he is not doing it, the functioning of his mental processes is not well, so now the functioning is also there is a malfunction of some areas or some practices. Okay, so some behavior is malpractice, there's some malfunction of behavior. So now abnormality is what? If there's malfunction, if there's discomfort, if there is abnormal behavior. Abnormal is what? Which is not normal, which is not normal in context. Okay, in context, if it is abnormal, then the behavior, the functioning, the malfunctions, the discomfort, we consider it as abnormal. So culture is very important. At the same time, if the culture allows you to do something, and if the culture in the society accepted something as a normal practice, now it is, if it is abnormal or normal, it is a normal event. Like cutting trees, and like we are not focused on environment much, so people are cutting trees, we are like making tables and stuff out of wood. So this is what it is, a normal practice. But yeah, if we consider in a wide perspective, it is very abnormal function. But yeah, the culture allows it, the society allows it, now it is normal. Getting it? So the context is very important. So understand abnormality with the span of normality. What is normality? Then abnormality is easily explained. Now let's there are a lot of myth related to mental health. Okay, now you have understood what syndrome is, what disorder is, what mental health is, what mental disorders are. Okay, now you have a good point of view over mental health disorders. Now let's understand if there are myth or something related to it. Mental illness is equal to weakness. First thing we have said, yeah, there could be possibility of low function, but low function is not weakness at all. It is an accident, it can be a trauma, it can be a stroke or anything. So yeah, malfunction of any particular area in brain, or malfunction of any cognitive disorder or any disability is not weakness at all. It is a medical issue. Okay, so if anyone who is like mental illness, he is very weak, that is why he got ill, or he get mental illness. If you are very weak, you will get mentally ill, है ना? If you are very weak, you will get mentally ill. You are mentally ill, why? Because you are very weak. So no, it is a medical issue, can happen to anyone, and will not happen to anyone who is practicing something which promote that kind of mental illnesses. Understand, we are just sitting on sitting on an extent where there's a lake. Okay, so we are just sitting on shore. So shore is the conscious, and the lake is the tides are unconscious. So you are sitting on a shore. So what is going to happen if by any chance you get into the water? Now this is what mental illnesses is. You are sitting on shore, you are happy, you are safe, but once you get diagnosed with mental illnesses, you get diagnosed with mental illnesses. There's nothing which we can do about it. Okay, what we can do about it? We can practice mental wellness. Yeah, but getting medical conditions or something, you can't do anything about it. Life is unpredictable. So mental illnesses are. So we can't predict on basis of any weaknesses or anything that person is going to get mentally ill. Second myth is mental illnesses are very dangerous. If you get diagnosed now, so it is not going to cure in any day possible. There is time period which is required for every specific disorder. Early intervention, if we diagnose it at very early stage, so it can be diagnosed. Similar like medical conditions. Okay, if you have a first case, if someone has first stage cancer, okay, and if someone have fourth stage cancer, so we can't say that cancer is very dangerous. There are cancer survivors who have survived cancers, so we can't just say cancer is very dangerous. Yeah, probably people think, why? Because they don't have much explanation, they don't have much medical nuances to deal with that. Similarly, in mental health, there were no nuances, there were no treatments available back then. People used to treat them weirdly. Like there is a time where they used to create a hole in the skull to get rid of mental illnesses. Why? Because they believe that their kind of some impure soul entered into skull, and when we break the skull, it will pass on from that side. Okay, so this kind of practices was used in mental illnesses. That is why there's a myth that they are dangerous. Most are not, most are manageable, and though which are not curable are still manageable. Okay, so understand this is, they are not dangerous at all. You can go for therapy session, you can go for checkups, you can go regular neurological checkups, and you can get fine by it. Mental illnesses can't be treated. Which can't be treated can be managed, and not every is untreatable. Okay, many treatments exist for single disorder. Okay, there's one disorder and there are 5 treatments for that. Understanding, so it is treatable. That is why it can be psychopharmacological is going to help, therapy is going to help, sessions are going to help, everything is going to help. Okay, so basic practices are going to help. Okay, so that is why many treatment exist, and so many disorders are treatable, and which are not treatable are manageable. Children do not have mental issues, they do. Prenatal baby also have mental issues. Okay, prenatal baby can also develop some mental disorders. So yeah, it is also not true that children do not have mental issues. They do have, and they have a very we can say they are like a blank slate. So they have very grasping over trauma. They grasp over trauma so well, they understand trauma so well, and they inherit trauma so well that it will somewhere disturb their past, their future relationships. Okay, it's all in the head. Okay, it is because of head, it is all in your mind. Okay, you are not mentally ill. Okay, there are a lot of people who was depressive, then I say, oh, just walk, go to that place, you will feel good. You are just in your mind, you are thinking like this. No, that is a pattern. There's thought pattern is disturbed because of some cause. Some trauma is there, some kind of stuff is there, some kind of abnormality is there. So we study biopsychosocial model. Biopsychosocial model is कि any cause is having a biological approach where there is biological basis for that thing. Okay, there can be some neurotransmitter which is acting abnormally. Okay, the release and the generation of these the neurotransmitter is abrupt. Okay, or is abnormal. Or there is psychological pressure is there, some societal pressure is there, some family pressure is there, some trauma, psychological trauma is there, or there's some social setting which don't allow a person to do something, or there's social setting which is very toxic. So biologically, psychological and social model is there which tells us about mental health or mental illnesses. Okay, so it is not just in head, it is in biology, it is in psychology, and it is in society. Okay, so biology, psychology, and society make a person's mentally well and mentally ill. Okay, now doctors need, okay, there are n number of disorders. Okay, now let's understand, if you are a professional, want to work in this field, you want organization, categorization of these disorders. To categorize and need a structured system, the WHO and DSM have developed 2 classifications of these disorders. One is ICD, Intellectual Classification of Disease, which is developed by WHO. So understand, if you understand the authority who has developed, na, you will understand a lot of about these books. ICD is the best book if you want to study any disorder. Every disorder is there, every classification is there. So yeah, ICD is recommended. Why we recommend ICD in India, not DSM? Because DSM is made by US, it is in US. And another thing is ki the medical professional we deal with, the interdisciplinary approach is reading ICD only. The medical professionals are reading ICD. Why? Because ICD have a lot of sections. Every disorder is there, every disease is there, and we are just reading F section of ICD. F section is for mental health. So we are just reading F section, but we have to we have to work with interdisciplinary, with a psychologist or a MBBS student, MBBS professional who have read the other sections of that book also. So they recommend us, they mention us with F10 disease, F9 disease. So we should know, we should have a good communication with them. That is why ICD is mentioned, ICD is recommended in India setting. But yeah, to know and just learn about disorder, DSM can also be. So WHO, when we talk about WHO, it's a World Health Organization. So World Health Organization. So every disorder is confirmed by, checked by, recognized by, and all the settings are done by the world level psychologists and psychiatrists and professionals. Okay, so mental health professionals and health professionals from every country, from everywhere, have contributed to ICD. And on the other hand, in DSM, the American Psychology Association, the APA, is already the authority who have contributed to it. Okay, so this is how we can differentiate. But both the books are good for learning disorders and knowing the classifications of disorders. It helps to identify, diagnose, and treat. Okay, so there's no treatment written in this book, but helps to identify and diagnose. Okay, ICD, there are two books also. First is for diagnostic manner, and another is for research. When you go for research book now, then there is a written, like there are 10 symptoms of that disorder, and out of 3 or 4 is if a person is having since the past few weeks or like this much of time, then you can diagnose that person. There is probability that person is having this disorder. So yeah, it is very correct to identify and diagnose. Yeah, and treatment is attached to the diagnosis only. That the symptom first, if you know or if you don't know, you just be empathetic, and you'll do what? You will approach a symptomatic relief. Okay, you will go for a symptomatic relief of that person. If there's some symptoms which are problematic for that person, we go for symptomatic relief. Yeah, so diagnosis is there, identification is there, and we have studied so much, so we can go for treatment of that condition. Okay, now there are diagnostic tools. So understand, if you have if you get a client, so first what you do is you do a case history of that client. Okay, so in this case history, everything is written about that client, how many people are in their family, there's family genogram, their prenatal abnormalities, their milestones have achieved or not, if there's any pet who is died in his family, if there's some miscarriage or something happen in his family, everything we get from the case history. Now we understood where we are going to, where this thing is falling, which kind of disorder could be there. Now there are some diagnostic and assessment tools. There are clinical interviews, structured assessment by ICD DSM, and there are a lot of NIPID and a lot of like organization who has developed a lot of tests like CAS2, ESA, which are there to diagnose autism. There are particular tests which diagnose stress, depression, anxiety in a person. So yeah, first we have understood the case history. Now case history, we have a way where to go, and now to confirm that disorder, now to confirm that problem, issue, what we do is we use tools helps us to standardize the diagnosis. Now our diagnosis is standardized, like, okay, and also help us in which it is used, the diagnostic tools are used in research and detailed evaluation. If I want to like take individual who are having stress or something, and I am testing some psychopharmacological drug, so first I'll have to diagnose that person Okay, and now I have a standardized score for that diagnosis, and after that medication use, after 1 year or after the 3 months or after 12 days or any kind of any timeline, if I studied after like 10 days or 12 days, so I'll use the same task or I'll use the same kind of diagnostic tool to know the stress of that person. Okay, so this is how diagnostic tools helps. Now we have understood everything about psychology, we have understood everything about mental health disorder, we have understood everything about a lot of things. Not everything, but yeah, it is a growing field, so we can say if we are studying now, we know everything. But for now only, for today's, we have know everything, but the day next there is another thing to learn. So conclusion, breaking the stigma. Okay, so break all the stigmas are there. Mental health is like a puzzle and everyone have a piece. You have a piece which can solve this puzzle. Okay, so this shows that this is ever evolving subject. Everyone comes with some unique puzzle piece which is going to help us understanding mental health. Knowledge helps reduce stigma. When we understood what is abnormality, so we got some a little unbiased. While reading psychology, we are day by day, if you understand psychology, if you practice psychology, if you read psychology on daily basis, you will get rid from this stigma, you will get rid from this unbiasedness and stuff. Okay, mental health is real, not in mind, not in something which is just in air or something. It is real, it is treatable, and it is universal. Everyone is having it, everyone is treating it, and everybody is getting cured if there is a appropriate medication treatment is available. Health is very important. Similarly, physical health and mental health both are very important. Okay, help is available everywhere. Counselors are there, some governments are supporting some caregivers and stuff. Okay, helplines are there, a lot of helplines are there for suicide prevention and for specific learning disability, and for like Manodarpan is there, Kiran helpline is there, and there is one another like suicide prevention. For suicide prevention there is helpline. Okay, so support systems are there. You can get involved to some support groups which like where people are having autism. So there is for parents of autistic child, there is a support group. You have to just go to a counselor, you just have to go to therapist, and you just ask to if there is some kind of group, or if there's no group, you can create that group. You can collect 4 to 5 or 6 individuals, and you can get like Sunday meetings where you guys can chill out, and you can ask and you can share your problems, and there can be group activities which can be done. So yeah, now we understood like there is nothing bad about mental health disorders, nothing yuck about mental health disorders. Okay, everything is treatable, everything is manageable, everything is there, and it will be there, and it will be forever. Okay, so forever it is going to this subject is going to be there, and it is going to evolve day by day. So now that's all from my side. Let's meet in next class.